AI is transforming healthcare, but not everyone is at the same level. It's time to assess where you are and where you want to go if you don't want to miss out on this innovation gold rush. We are talking about the 5 levels of what it means to be AI enabled in your healthcare organization. My goal today on this video is really help you think about what level you're currently at so you can figure out how you get to the next level if you want to, right? And I also want to talk a little bit about the benefits, liabilities of each level so you can get a better sense of what that means for your organization for the future. Why is this important right now? I think this level thinking will help you focus so you don't get excited about new things, right? If you're already at a certain place, guess what? Yes, there's going to be new innovations coming all the time, but just stay focused on where you are and know there's levels to this. And you get to that next level with just some focus and planning. Next, you want to understand like what resources it will take to get to that next level. Don't jump to the other levels just because something looks nice and shiny. You may not be ready for it yet, right? Also understanding the risk that will entail if you do go to that next level. And last but not least, the goal is here to help you kind of see the complete picture of where AI is going. I'm going to walk you through each step one by one, but I want to show you where it is now and where it could go for the future so that you're prepared and also thinking ahead so you can plan 3, 4, 5 years down the line when it starts to come like a rush into your organization. Currently, I think we're seeing AI being used across the country, and I want to give you about 5 different use cases and kind of what percentages each of them are at when it comes to delivering AI in healthcare around the country. First, we're seeing AI-assisted medical imaging, right? This has been around for a while, especially around radiologists, and this is really helping to interpret things like CT scans and MRIs for faster, more accurate diagnosis. It's been around for a while. So we're seeing a lot of healthcare organizations, especially hospitals with radiology departments, about 30% of them are already kind of doing this AI-assisted radiology look at. When we look at predictive analysis for patient risk, that's the other huge area. Right now, 25% of large healthcare systems are using predictive analytics in order to determine what's happening with their patient populations. And this has been around for a while, right? This is actually using, AI, but back then it was called machine learning and basically high-level statistics to understand which patients are going to need your help and be more predictive to determine if they're going to have adverse events and identify really those high-risk patients so you can prevent them from having even worse conditions later on. Those are kind of like ones that have been around for a while, but the newer ones that we're seeing starting to really take uptick and really grow aggressively is first, automated clinical documentation. This is also known as a better name of AI Scribes. This is basically using natural language processing to automate medical note-taking during patient encounters. Roughly 17% of organizations are using it within the EMR so they don't have to manually type all that information in. And so it really saves a lot of time. The next one, we're seeing kind of workflow automation when it comes to streamlining competitive administrative tasks like claims management and appointment scheduling. We're seeing a lot of large and medium-sized medical organizations really looking at this, around 22% of the ones out there in the country. And last but not least, an area that near and dear to my heart, remote patient monitoring and alerts. And so what does this mean? This is using AI to collect and analyze data from basically monitoring patients at home, away from the clinic, and using these data from wearable devices, glucose monitors, continuous glucose monitors, blood pressure cuffs, and coming up with data to give early alerts to providers and healthcare clinicians. We're using it ourselves to reach out to patients and help them with compliance. Patient compliance is huge, and being able to monitor that's a great effort. 15% of all solutions out there are using some kind of AI tools, and that's the forefront. So as you can see, AI is pervasive already. But guess what? Not everybody is using it the same way. Look, before we begin, I want to make sure you're ready to think through what level you're at. So before we begin, kind of think through that and get prepared so you can understand where you are and assess yourself and get ready for the new normal, because this is coming faster than you think. So before I get into all that, these are the 5 levels that we're going to talk about. First, we're going to talk about level 1, which is you're not using it at all. And so you have current employees doing all the things, but you're not using it. And so we're going to talk about why and what that means. The second level would be understanding the use of AI scribes and some use cases inside the EHR. This is like base level where a lot of organizations are starting at, as we see now. The next level is now thinking about AI from an organizational standpoint and providing AI access to your employees, but more importantly, toward a common goal, not everybody doing their own thing. On level 4, we're looking at AI automations. This is basically workflows that are automated to do things that you already are doing, but now can be repetitive in the machines. And then last but not least, you look at AI agents and then software with AI built in. And that's really the God level. This is where organizations are at and future organizations want to be at, where they're going. Once you kind of figure out what 5 levels you're at, then we're going to talk about, understanding what it takes to get to the next level. And then also, what the benefits and liabilities of that next level. So you understand what you're getting yourself into. My name is Theo Harvey. I'm a serial entrepreneur who went from lowly employed to CEO that runs a multi-million-dollar healthcare organization from his home. I raised over $1 million from VCs and investors, and I worked with larger organizations like Cisco Systems, AT&T, Blue Cross Blue Shield, and Google. My goal on these channel is really to help healthcare organizations prepare for the new normal in healthcare before it's too late. We're going to go into the 5 levels that I just discussed earlier. And the first level we're going to get into is not using it at all. You're a medical practice owner, you have all the staff from the front desk, back office staff, medical assistants to prepare the patients. You even have EMR and practice management software. You're kind of dealing with all the things, and this is great. Everything's fine and it's stable. But you know what? You probably think of artificial intelligence or AI as a fun little tool that you use personally from time to time. You may have OpenAI for free, but you're using it to do simple tasks like maybe check that spelling on that next email you send out, or asking the simple questions to kind of help you think through certain things, which is great. But you know what? The only way you really need to get to this next level is you really need to see the power of AI for yourself. Beyond the basic level. I'm going to tell you a story. For me, I used it just like everyone's played with it. Have my son up here and we kind of played with AI and looking at funny things it could do and repeat back to us. And that was great. But you know what? It is so much more powerful when you kind of think outside the box. And for me, that was really helping me understand how medical procedures work, understanding new medical literature, and really unpacking that with the help of AI, explaining language I can understand, but more importantly, how can I implement it? And I think that's really what was the unlock for me, because it really opened my eyes to, hey, this tool is extremely powerful learning tool and really a thinking tool. It helps me think more clearly on what I can do better in my current day-to-day job. And that's went from a toy to a tool. Let me say that again. And from a toy to a tool. And I think that's what you need to realize when it comes to using AI and getting to the next level. If you want to try a simple prompt, next time you want to better understand the latest medical literature that you're reading, I say download the article and just ask OpenAI with the following prompt to help you select, understand, implement this new medical knowledge in your healthcare organization. Basically, the prompt goes something like this. Act as a medical literature analyst, create a 1-page brief on intervention for some kind of condition in this type of population, and base it on the most pivotal, highest quality study, and to produce a 1-page clinical playbook to implement this intervention for condition immediately. Assume a general, setting such as a outpatient cardiologist or a hospitalist service. Bonus points for you. If you have a more advanced AI chatbot, you can have it pull it from PubMed, clinicaltrials.gov, or the FDA websites for drug information so that it can automatically look that information up for you. Or you can actually use AI to help you write a prompt better, right? And do more with it. Like I said, the sky's the limit. And if you want to check out that prompt, put it in the notes below so you can just copy paste it, but try it and see if it works for you, if you're at that level 1 when it comes to using AI in your organization. Now, let's get to level 2. At this level, you play with AI Scribes to help with documentation, right? You may even have some features in your EHR to help you with triaging patients based on some kind of risk score. This is huge, right? So you're seeing the benefits of using it. And I think the best benefits you're seeing is starting to see how this tool can save you hours in time. I actually did a video on this where I detailed how much time you could waste with just documentation. Spoiler alert, it's roughly about 50 work hours. So if you want to check that out, go check out that video here and you can kind of look at it and see what I talked about there. But AI is actually doing the documentation for you, and that's helping you free up more time. So it is really helpful in doing that. And then I think a lot of organizations love that aspect of it. AI doing the documentation is great, but at this level, I think the goal should be to figure out how to give it more optimization out of the AI. So how do you tweak it to get better workflows, better processing of what you're trying to understand, especially if you're doing clinical notes, right? If you're doing charting, you want to make sure that charting is as accurate as it can be. And so in your current workflow while avoiding AI response mistakes, because you want to understand if the AI is making mistakes, you want to correct that. Because if you didn't know, AI can absolutely go in different directions and give you responses that are wrong because it does something called hallucinate. It will make up answers if you're not careful. And so you want to make sure you have not just optimized workflows, but you also have some way to understand if that knowledge and that response is the most accurate it can be. For example, if you're recording all your clinical notes with an AI scribe manually, maybe figure out a way to have it do it automatically and then incorporate a weekly check-in process to validate the correctness of the charting. Now, we really want to get into level 3. This is where you're thinking about chat AI access to all your employees. And not just chat AI access, but all AI, so that it's focused on a deliverable for the organization. So at this level, you have your employees that, guess what, if you didn't know, they're already using AI, top secret, but they aren't telling you. And I think that's the challenge when it comes to the organization usage of AI. We're seeing there is no sense of how to use it as an organization. I think that's a big gap. I think there's a big gap between level 2 and level 3. But the key is, especially with healthcare, you have to be careful protecting PHI, or patient health information, because if your employees are using AI incorrectly, that information get out, and that is a violation of HIPAA laws. So the key is to kind of implement some kind of artificial intelligence standard operating procedure, or SOP, on how your employees will use AI in the organization that meets the standards from a regulation standpoint, as well as from an organizational standpoint. So I can tell you, a story when we started, right? AI came out, we started to use it, play with it. I think people were having fun with it and doing fun things. I think for Christmas, one time I did a Christmas carol, and sent it out to everyone in the style of our business and our industry, and everybody had a kick out of that. But over time, as more and more people play with it, are using it to kind of create clinical workflows, things like that, which is fine. But the challenges started to pop up where actual patient information started to get in some of those workflows. That's a no-no. So we had to implement, with the help of our IT lead, standard procedures to make sure none of the information got out. And we more carefully set up parameters on making sure everyone followed certain strict guidelines for that. And then we also allowed them to use AI, but we also had our own standard version of it so everyone can use it and use it safely in our environment. So yes, you can have your own AI version that's on you, but you have your one that you can use based on our company workflow. And we have some things called custom GPTs that do certain projects for everybody, so everyone has access to. And I think you have to evolve to that point if you want to deliver AI at scale, because it's only when the employees are using it and everyone's aligned, then you're going to see the massive benefits that AI can bring to your organization, and not just to you as an individual. Next, we're going to get into level 4. This is where we're going to talk about AI automations. This is the beginning in helping you scale your healthcare or medical clinic profitable. What does that mean? With AI automation, you can start to put together powerful workflows that take tasks off your plate, not just your plate, but also your employees' plates. And it really makes getting things done a snap. So what does that mean? So there are tools like N8N and Maker. You can create an automatic workflow that you can take data from AI scribes and triage it inside of your EMR, so you know the priority on who you need to reach out to, and do so automatically without ever having to lift a finger. These are workflows, are powerful workflows you can do. I think this is a great tool. The challenge is the upfront ability. This is something that you have to put upfront time into understanding the tools, and more importantly, you need to make sure they protect PHI again, patient health information. That time is worth it, right? But I can tell you right now, when we started doing AI automation, we kind of did it initially for our marketing efforts. So reaching out to potential doctors, potential partners, which is great because it's low level. If we messed up, we said the wrong thing, no harm, no foul. But the challenge was it kept messing up, and we had to tweak it, automate it. We had to figure out more things constantly. We got to 80% there, and I can tell within the first couple of days, 80% of it was done. The last 20%, tweaking it, getting the right words, not misspelling, not saying anything out of pocket, took us another 2 months to optimize it, right? We failed time and time again, so we can get better and better at tweaking it, which is fine. But once we kind of got it working, then it worked for us all the time. So the secret is here, when you think about this story, is that you have to be willing to continue to fail over and over again, because the ones who fail are the ones who win. Let me say that again. Those who are willing to continue to fail over and over are the ones who will win. it is imperative that you be willing to put that time up front if you want to be in this level 4. And last but not least, we have level 5, the God level, AI agents plus AI software. This is huge, the ultimate level. And I think about this as like AI agents that are specialized employees that can do everything you want them to do, from sending medical billing to patient outreach to claim processing to handle denials to doing prior authorizations. You can have an AI agent that does it all, which is amazing, right? You also have new AI software tools that can do some of the functionalities of running a medical practice, like medical billing and EMR. There are actually new tools, for instance, like Canvas Medical that does EMR, and Steady, which is a billing solution that were made with AI first in mind. So that means they have all the connection points in order to do this, and you can create all these great automations and kind of get things going on your own without a lot of headache, right? And this is going to be a powerful tool. One of the things that we're seeing is like large organizations are still really kind of delving deep into this, and they have the big IT departments to do so. So what they're doing is being able to protect their patient data from what they call foundational models. This is like the OpenAI, Meta, Google. They create their own kind of AI tools. They train their own models up with their own processes. And I talked about in a previous video as well on how ChatGPT and other kind of chatbots work when it comes to AI and how they learn it over time. And it's really more of a predictive algorithm to understand exactly what's likely for a human being to say in this given environment. So OpenAI, Meta, Google spend billions of dollars to build these foundational models, but I'm seeing large organizations kind of put filters around it so they can abstract information to help with certain things, but they're still protecting PHI, and that takes a lot of IT effort. Likewise, I'm also seeing customers start to create what they call model context protocols, or MCPs, which are basic connection points and instructions in order to kind of use AI to kind of do things automatically for you. So you can automate billing, so you can automate your claims processing, and it's all done for you just with your own MCP, and you can control that connection point. So for instance, access to your EMR, logging in, looking at information in there, right? That can be controlled with this MCP, and you can create your own agent without the use of, off-the-shelf agents, which is powerful. So these are great levels that you can get to. This level 5 is definitely seems a lot of upfront work. It is a lot of work, to be honest with you, to get to this level, but I do believe that it's worth it, especially for medical practices who are really want to get into this, because I can truly believe that this will transform the access, the affordability, right, and the effectiveness of medical clinics at the local level. Because imagine if one or two professionals, healthcare professionals, the doctor, a front desk person, can manage thousands of patients. Imagine what that would mean for the cost, deliverability, as well as effectiveness of healthcare for certain regions, especially in rural healthcare. This is huge. So I really want to see more investment there and where it could go for the future with the right tool sets, because the sky's the limit for these type of organizations. Here's a simple action. Just pick what level are you at, right? And just be honest with yourself. I would say the majority of you are probably at 1 or 2, but some may start be getting into level 3, but in very few 4 and 5. We're starting to get into 4 and 5 ourselves. Where you are in your current workflow, and just mark it down. Go ahead and get a pen and paper, write it down, and then we'll talk about what that means next. Because number 2, you really need to understand what level you are so you can think about where you want to go next and what it would take to get there, and really think about the benefits and liabilities. Albert Einstein said, if I had an hour to solve a problem, I'll spend 55 minutes thinking about the problem and 5 minutes thinking about solutions. I think the key here is you have to understand your current employees. If you are not using that at all and you have current employees doing all the work, then you want to understand, the benefit, which is stability. This ain't going anywhere, right? You can do the same thing over and over again and have any issues. And I think that's so key. But the challenge there is it's going to be tough to grow, because you're going to have to put more inputs in, more time and effort, and that can lead to the liability, which is burnout. And also you're not innovating, which is going to be a problem, because more and more innovation is going to come into this space and you're going to be left behind. So it's definitely not an option for the majority of people. If you're listening to this video, I'm sure that's not an option for you. So we're just going to move on to the next one. I would say the next one is basically, we talked about, having some AI scribes and some EHR enhancements. The benefit there is free time. Documentation, we talked about that, can save, hours of time, which is great. It gives you open time and things that maybe you never done before using technology. The liabilities here is that the AI does and will make mistakes. So you need to have a person in the middle that can manage that process. And that can take a lot of time and effort to kind of sort through all that. And so you have to be prepared for that. The next level was like, giving AI access to your employees using AI from an organizational standpoint. The huge benefits there is scalability. You can scale your organization dramatically and do great things with that organization. And so because now you have AI tools that everyone has access to and they can do great things and do more with not that much input. Challenge there is the people time. You have to spend a lot of front time with people to get them trained up, not on just the AI tools, but understanding what they need to do next, at least from an organizational standpoint, right? So they're all in line and so everyone focused on the same outcomes. Next, our AI automations. Benefit here is that you can scale, but it's lower cost. So it's the same kind of benefit of the people, but now you're doing that. Machines are doing the work. Machines are cheaper than people. And so you can scale with the AI automations. But the liabilities here, previously you had people time. This one is tech time. So much upfront effort to kind of deliver these tools. You can get there pretty quickly, 80% of the time or 80% of what you need. The last 20%, which is pretty much what you need to kind of make it work all the time, will take a lot more effort. And you need to prepare for that. And then last but not least, the God level is the AI agents with AI powered software, right? The benefit is here that you'll be the innovator. You're going to be the leader. People are going to look up to you. They're going to come miles away to kind of understand how you deliver this kind of clinician that's AI enabled with AI software, that's doing all the things, using people very little, but more importantly, providing the best care for your patients, which is great. The challenge here is you have what they call pioneer costs. What is that? Well, think about the people that were on wagon train, the people that went to the gold rush in California. Any type of pioneer, there is a high cost. In those examples, those high costs were sometimes people lost lives due to disease, war, famine, things of that nature. The pioneer cost may not be that extreme when you're out there doing these technologies, but you may go down rabbit holes, paths that cost you lots and lots of money, right? If you don't know what you're doing or you run into issues that no one else saw coming because you're paving a path. But again, to the ones who risk most, the rewards go the most to them. You have to risk more if you want more rewards. And if that's the path you want to go, then definitely I say start on that path and prepare for that for the future. One thing I can help you do, we offer a free masterclass where we talk about things like this, how to use technology, enable your medical practice to grow new revenue. We do this masterclass every so often. So if you want to check it out, click on the link below and sign up. This space is usually limited, but if you put your name up, we'll reach out to you and we'd love to kind of connect with you soon. So I think we talked about the 5 levels of what it means to get to the next level when it comes to AI tools. We talked about those who don't use it at all. We talked about the individuals who kind of use some AI scribes to kind of help with clinical documentation and some EHR enhancements as well. We talked about giving AI to all your employees so they can be more efficient and, there's organizational use of AI toward a common goal. We talked about AI automations, right? How they can really optimize your workflows and make you guys more efficient and scale profitably. And then finally, we talked about the God level, the highest level, AI agents with AI-backed software to make it all work together. And we talked about where you are, where you want to go, and the benefits and liability of that. In the comments below, tell me what level you're at and what benefits do you want in your medical practice using AI today?